name is Kathy, and today I'll be demonstrating how to insert and discontinue a peripheral IV. So I will do a hand hygiene. I'm going to put on some gloves. I'm going to introduce myself to the patient and ask 2 patient identifiers. I'm going to close the curtain for privacy. I'm going to gather my supplies on a clean surface. I have a 22 gauge IV catheter. I have a start kit. I have an extension tubing. I have a sterile flush with normal saline. And I'm using a 22 gauge catheter because it's appropriate for my elderly patient with fragile veins, and it's sufficient for fluid rehydration. So now I'm going to prime the extension tubing with normal saline to remove all air bubbles, and I'm going to set it aside. So now I'm going to apply a tourniquet 46 inches above the chosen insertion site, and make sure it's not too tight by checking for a distal pulse. Okay. And then to clean the site, I'm gonna use an alcohol prep pad, and I'm gonna apply it in concentric circles, moving outward, and I'm gonna let it air dry completely. Okay, and then so now catheter. Okay, so now I will anchor the vein by placing my thumb about 1 to 2 inches below the site, and I'm gonna pull the skin taut. Okay, and then with bevel facing up, I'm going to insert the catheter into the vein, and then once I see a blood return in the flashback chamber, I'm going to advance the catheter about a 1/4 inch further. Okay, I'm going to push the catheter off, and the needle until the hub reaches the skin, and then as I advance the catheter, I retract the needle. Okay, and then I'm going to place the needle into the sharps container. Okay, I'm going to release the tourniquet. Okay, and then we're going to attach our extension tubing. Okay, so now I will aspirate for blood return to check patency, and slowly flush the site with normal saline. Okay, and I'll watch for signs of infiltration, such as a swelling, pain, or discoloration. And now I'm going to clamp the tubing. Okay, I will remove the flush syringe, and I'm gonna discard it. Okay, and then let me see. What's this? Okay. Put the cap back. Okay. And since we're not using a real arm, you can see there's some saline there, but I'll just wipe it down. Okay. So now I'm going to apply a sterile transparent dressing over the IV site, and just make sure the insertion site is visible. Okay, so now I'm going to So now I'm going to loop the extension tubing alongside the arm and tape it in place. So just make sure don't tape over the dressing. Okay, so now I'm going to label the dressing with the date, time, catheter gauge, and length, and my initials. Put it on this side. Okay, so I'm going to discard all used supplies appropriately. Okay. And then the needle goes into the sharps container, and the rest is in the trash, and then I'll remove my gloves. Right. And I'll perform hand hygiene. Okay, so now I'm going to discontinue the IV. But I'll first verify the order, and then I'm going to perform hand hygiene, and then I'm going to apply clean gloves. Just let the patient know what you're doing. Oh, before I get one, I have an extra floss here, so I'm just going to put it on the table before I put on my gloves. Okay, so I'm going to ask for 2 patient identifiers and close the curtain for privacy. So now I'm going to remove the transparent dressing while stabilizing the catheter. I'm sorry. Okay, there we go. And then I'll remove the tape that's securing the extension tubing. Okay, and then using a sterile gauze, I'm going to apply a gentle pressure just above the site while withdrawing the catheter slowly and steadily, keeping it parallel to the skin. Okay. And then I will hold pressure for at least 30 seconds or until bleeding has stopped. Okay. Okay, so now I'm gonna inspect the catheter to confirm that it is intact and the tip is complete. Okay, I already threw it away. And then once the bleeding has stopped, I'll apply a new sterile gauze. And then I will tape it securely. Okay, and then I will discard all of my supplies in the sharps container, especially the needles, and then I'm gonna remove my gloves, and I'm gonna perform hand hygiene.